right, you take a pill for your heart, another for your allergies, one more to help you sleep.
Yeah, it doesn't sound like much, but that combination of prescriptions, over-the-counter medications, supplements, and vitamins can cause problems you might not expect. And the Fox Medical team's Beth Galvin has more.
Medication has a lot of benefits, but the more drugs that you're on, the higher your risk of side effects and dangerous drug interactions. And that's why one expert says we need to really take a look at what drugs we're taking.
Do a little medication math. How many pills do you take a day? If the answer is more than a handful, Griffin consulting pharmacist Armon Neel, the author of the book Are Your Prescriptions Killing You?, says you may be taking too much.
If you own 4 or 5 drugs, then the 6th one is you're being given to treat something that those 4 or 5 are doing, not the disease.
Neel works with patients, many of them seniors, trying to cut back on the number of drugs that they're taking because he says often medications can cause more problems than they solve. For example, if you're having new side effects or issues that you didn't have before you started taking a drug, that's a red flag.
And these things might not be the next day either. You know, sometimes you might have to take the drug for a year before you start developing side effects, right?
There are other warning signs too. You have multiple prescriptions from different doctors at different pharmacies, or you find yourself taking more than the recommended dose or using a drug for longer than you should. And Neel says watch the over-the-counter medications too, especially those that contain acetaminophen or ibuprofen. In large amounts, they can cause liver damage.
So many people think that, well, if you can buy it without a prescription, it's not going to hurt you.
And Neel says people need to remember over-the-counter drugs and supplements are drugs, so they come with the same side effects and drug interactions as prescriptions. So if you tally up what you're taking, count them too. And he says he's worked with many seniors. They're usually taking anywhere from a dozen to 20 medications.